Member statements. Member from Simcoe-Grey.
Thank you, Speaker. Mr. Speaker, Dalton McGuinty has launched an assault on community pharmacies. The Liberal government's changes represent a serious cut to frontline healthcare services, particularly in rural and small-town Ontario. This is an attack on the viability of rural pharmacies and the availability of pharmacy services in my riding of Simcoe-Grey. For the past 6 years, Ontarians have paid $15 billion into the Liberal health tax, yet they are receiving less and less in return. At the same time that we uncovered the billion-dollar e-health boondoggle and huge amounts of money being wasted at the local health integration networks, small-town pharmacists are being driven out of business and being told to close their doors. In Simcoe-Grey, people are already getting the short end of the stick when it comes to public health care. Doctor shortages, small hospitals, and lack of transportation, to just name a few of the issues. Now Dalton McGuinty wants us to pay more and travel further to get the medication we require. This is unacceptable. I know many of our local pharmacists, and I know them to be upstanding and generous members of our communities. Dalton McGuinty's assault on these professionals is unwarranted and unbecoming of the Premier of Ontario. Mr. Speaker, I'm committed to defending rural Ontario, our small towns, our farmers, our schools, and our health care. In doing so, I support our local community pharmacies and the good work that they do. If this government doesn't change course, my constituents can expect to drive further, receive less service, and face new user fees. Thank you, Mr. Speaker.